In this video, we're going to discuss the potential benefits of mixing injections of testosterone with the scrotal testosterone cream. Stay tuned. Hey guys, welcome to the Danny Bossa podcast. I'm joined today with Justin Groce of the Restore Clinic. We were having a little talk offline, and I just discovered that Groce, as an Italian, I should have realized this is an Italian last name. And I asked him, "Are you Italian?" Fill me in, because a lot of people have seen your videos on the YouTube channel of Stephen Devos, TRT and hormone optimization, but they might not know what you told me offline. And just tell us real quick.
So yes, my last name is of Italian descent because my father, he's about a quarter Italian, who grew up in Tennessee, which is random. But my mother's actually from Japan, like straight up from Japan. So growing up in the South, being, half Japanese with parents that aren't quite the typical protocol that you'd find here, makes for an unusual vernacular, and hence why my accent is, I guess, a pseudo-Southern, whatever the fuck it is.
So you're half Japanese,
yes.
Mostly American on the other side with some Italian, and that's why you have the last name Groce with your Southern, ultra polite, I never would have guessed. That's really cool.
Oh, and to top it off, my middle name is Lee. Of course it is.
Of course it is.
Of course.
Cool.
A very Asian's Lee.
So guys, the topic today is talking about the benefits of mixing injectable testosterone with the scrotal cream. And you may recall a couple of years back on the TRT and hormone optimization channel, I did a video basically saying how stupid and dumb it was, mostly because guys are having a really hard time getting dialed in sometimes, and those are the ones that typically watch these videos and go into the groups and stuff. And I figured, what better way to complicate a man's further by asking him to incorporate an additional compound, and then he's got to figure out, okay, when I have to raise the cream, and do I have to back off on the injections or back and forth? I said, I figured they were both testosterone. Pick one, pick the other. It's just two different methods of administration. Just keep it simple. Figure out one or figure out the other, until I decided to try it for myself. So we're going to delve into that. So Justin, you've actually been doing this a few years. So tell me how you kind of discovered this yourself. It was just coincidence that we talked about it. You were doing it yourself. So how did you come around to realizing that there was a benefit of combining them for some guys versus just doing one or the other?
So it actually started, I'd say probably maybe 4 years ago. I had a patient that he presented to me. He'd originally started on the cream, and for whatever reasons, compliance issues, maybe couldn't get it, I don't know, whatever. He switched over, and so we kept him on injections for a while. Well, lo and behold, he was like, you know what? I kind of missed the cream. I kind of missed that libido enhancing effect. I was like, well, instead of just trying to go back all the way back to the cream, why don't we just keep the injections rolling? Because you said it gives you great energy. You said you feel damn good on it. I really don't want to mess that up. And the only thing you're complaining about now is, well, you feel like your libido could still use just a little bit of work. So what the hell, man? Let's do it. Let's throw just a dab of cream on in the morning. And so we started with that. And after a few weeks, he was like, man, that just adding that little bit of cream gave him the bump he needed every day. It was almost like, I refer to it as his ball coffee, so to speak. He put a click on in the morning. He said it'd pep him up for the day. And meanwhile, he was on the injections. I had it on twice a week, and he said he just felt absolutely fucking phenomenal because the injections kept him cruising, and the cream just gave him that extra little bump that he liked every single day. And so I've started doing that now with some patients that I find to be somewhat refractory. And when I say refractory, I don't necessarily mean like the testosterone doesn't work. I mean that I've got them on injections, every box is checked, but they need that little pick-me-up. So then we'll sometimes sprinkle on a little bit of cream right in the morning, and bam, almost always seems to get them right, especially with that libido kick.
Okay. And did you question the reason why it was that the cream was doing this specifically? Like, did you say to yourself, well, why don't we just bump up your test? Or did you find it odd that he was getting this bump of libido on the cream that he wasn't necessarily getting on injections regardless of the dose? Like, how did you arrive to, was it just a matter that you tried it like, oh, this works, let's do it? Or did you question the kind of mechanism? Like, I'm still kind of theorizing what it might be, but what's your take on that?
Sure. So with that gentleman, he'd been on various doses of the injections. We've scaled him up, we've scaled him down, we've got him right in the middle, which you'd call, more of a standard 130, 150 a week. And every box, he felt great. No more brain fog, mood was great, had great zest for life, sleep was great, recovery was great, no depression, no anxiety, but libido was still subpar. But I knew that the mechanism of action with the cream is that, the testicle, the skin, it's a rich source of 5-alpha reductase, man. You slap that bad boy on, you're bypassing straight down the DHT lane. And so I figured, what the hell? He said he had better libido on the cream. The mechanism of action made sense. Shit, let's just throw it on. Why not? And he was game for it. And it's been a few years, and he's still rocking and rolling with that hybrid method. So,
and was it he wasn't sticking to the twice daily application, and he was missing doses and like, oh, I just can't stick to it? Is that how this whole thing transpired? Or was he on the cream and just felt off only doing the cream type of thing?
Well, excuse me. The reason he switched originally was because his line of work, he worked outside a lot, he was sweating a lot, and there's some variability from blood work to blood work, and there's times when he'd say, man, it's going to be a hot day, compliance is becoming an issue. So that's kind of why we went to the injections.
Gotcha.
Mm-hmm.
So in my case, what happened was I was on testosterone. First of all, the first time I heard about this hybrid method was way back in the days. I don't know if you remember those doctor roundtables they were having on YouTube on that certain channel whose name I don't want to mention, but there's Dr. Jim Meehan in there, and he was using this hybrid method back then, mixing stuff up. Mm-hmm. And I remember bitching him out on social media, thinking, here you are trying to complicate things further, complicate people's lives further, now making them wonder what I have to adjust and this and that as a means to potentially sell more meds or whatever the hell it was. And here we are now, fast forward many, many years, where I was doing really, really well on the injections. And a lot of people were saying, you got to try the cream, you got to try the cream. There's a lot of people that switched from the injections to the cream, and they said that this is like mind-blowingly good. And I get to talk to Neil Rousier every now and then. Mm-hmm. He's got all his patients on the cream, like literally all of his patients on the cream. No one's on injections. Free T levels through the roof, DHT through the roof.
Yeah, for sure.
Like, this is the way. And Eric Serrano, who's a big follower of Neil, Eric looks up to him like a god, and he's like, Neil really knows his stuff. He's a true clinician. So I'm hearing about that stuff. I'm like, okay, well, I did videos on the topic. Let me at least give it a try, and at least I can see what guys are going through. Maybe I get a benefit of some kind. I don't know what it could be. I'm already feeling pretty damn good. So I switched over to the cream, and I was doing the typical 100 milligrams in the morning, 100 milligrams at night. And within about 2 days, I was just wound up like a top. Felt very aggressive. Felt like I was in a bad mood, but my libido was through the roof. Like I'm literally chasing my wife around the house. But it was just so worked up that I knew that if anyone would come in front of me, like they're gonna get it. Like I won't be able to stop myself. They're gonna get it. So I'm like, okay, I see benefits with this, but I'm not. The rest is not viable long term. I'll wind up in jail. So I've tried to figure out what was the amount of cream I could tolerate, and I kept backing it off, till I wound up to about 50 milligrams in the morning, and anything more than that I could not tolerate.
Yeah.
And my doctor gave it to me in a syringe where I can squeeze out a certain amount, so it's not in the toppy click. So I realized I could take up to about 65 milligrams, and more than that, stuff started not working.
Sure.
So I knew that 65 milligrams, I'm probably getting that DHT boost, as you said, from the 5-alpha reductase enzyme in the scrotal skin that converts the test into DHT. But I said, there's no way that my levels are going to be where they were on my, 250, 300 milligram a week TRT. So I said, let me drop my dose down to maybe 200 and add that 50 milligram. And the difference has been night and day for me compared to only doing injections. And I thought the injections were fantastic.
Well, sure.
My mood is better. I sleep better. My libido and erections are better. Like my erections right now are like Cialis grade erections.
Like a door stopper.
Like smashed through drywall.
Yeah.
Like they are ridiculous. That I mean, they were great on the injections, but not like now. Now it's just, it's unbelievable. It's just a better sense of well-being. I feel more alpha, but calmer. Like I'm at peace with myself, but like it's there when it's really hard to kind of put into words. And that was just by combining the two and figuring out, let me add a bit. And the interesting thing I brought up earlier was Dr. Jamian was he would only bring guys up, put them on maybe about a max of 50 milligrams a week from what I heard. Contrary to what Dr. Neil Rouzier does, who just puts them exclusively on the cream as much as they want. Jim's thoughts were he doesn't want DHT too high for whatever the reason. I'm not sure what that is. I never really got a chance to talk to him. And if anyone's watching this and knows Jamian, if you'd want to have him come on, I actually reached out to him on Instagram. I apologized for bitching him out. I was getting an earful from a particular doctor, again, whose name we're not going to mention because he was telling me, Jim is this and Jim is that and Jim is that. So I was like, yeah, Jim is in it. And sometimes you got to stop listening to idiots out there and get to know someone for yourself and figure out who they are for yourself. But I'd love to have him come on at one point and discuss this topic because I'm very interested by it now. That's what I'm doing now.
And that's what I've found is like, honestly, 25, 50 milligrams a day, that's really just, it seems to be like the icing on the cake. Now, I've got just a handful of guys that are on, 100 milligrams on top of the testosterone injections, but those guys are outliers. I would say the overwhelming majority, honestly, they just need one click. That's about it, just to put that final icing. And just like you said, those guys are telling me that it has been a game changer in terms of enhancing their sex life. Seriously, like what you're telling me, better erections, better orgasms, and just that vigor, just that damn vigor, and they feel fulfilled too. So man, what you're echoing is exactly what these gentlemen are echoing with me.
Interesting.
Yeah, man.
So the way I kind of see this though is, if I was a clinician or I was doing this for a living, I don't know if I would necessarily put guys on from the get-go.
No.
On a combined protocol. I'd probably say let's choose one. I'd present both options and say, you might be better with one, you might be better with the other. We're taking a guess as to your starting dose. The starting dose could be a complete disaster, or it could be the best thing ever. We have to start somewhere, so let's start with one and see. I would try to personally say, let's get him dialed in on injections. If he's dialed in on injections, fantastic. If he's dialed in on cream, I think it would be more along the lines of, been working for a guy a little while, we've tried the injections, we've tried the cream, we're seeing benefits, and then we say, okay, let's try to combine the two based on what we've discovered so far. But I don't want the newbies out there watching this video saying, oh my God, I just got on TRT, it's been a month and a half, let me take both because I want Cialis grade erections too. No, don't do that. No. This is like further down the road.
It's very advanced.
Yeah, it's advanced.
And this is for like a small niche amount of patients. I don't think every patient needs it. I don't think the overwhelming majority. I think there's just a small bunch of them that this hybrid would be beneficial to them. But overwhelming majority of guys, get away with one or the other and are totally fine. So I don't want them seeing this and misconstruing and thinking, oh, let's call Justin and let's get on the hybrid right out of the gates. I don't want that.
No. But I wonder if straight up DHT cream would have the same effect. Like, is it specifically the DHT that's doing this? My guess is yes. Or I can listen to Eric Serrano, who says the testosterone in the cream is not attached to an ester. It is truly 100% bioidentical, untouched testosterone.
Yeah, it's just doing its thing going in.
Yeah, and his view is that exerts a different effect on the receptor compared to testosterone that was previously attached to an ester. And obviously, once the ester is cleaved, you're left with testosterone. But the testosterone molecule at the carbon atom has some very, very minor changes that are made to it. And he theorizes that testosterone may exert a different effect on the receptor compared to the one from the cream. Now,
It's all speculation.
I don't know. My guess is it's likely the jump in DHT. And I guess that could easily be, we could easily solve that by saying, let's get some DHT cream.
Sure.
Let's apply, a given amount. And if we get the exact same benefits, we'll know that it's that. But
it's all speculation until then.
Yeah. Yeah. Anything else you want to add to this? We didn't cover, Justin?
I don't think so. I just wanted to have a good primer on that so that people know that if they're considering, or if their provider proposes the idea of possibly a hybrid protocol, don't think you have to run. They're most likely they're listening to you. That's what matters most. That you're with a provider that's actually listening to you and gives a shit enough to be progressive enough in terms of your treatment that they're willing to try something that's completely outside of the box. Convention.
Absolutely.
Yeah.
So guys, I need to reiterate something that Justin just said here. I'm seeing a lot of these testosterone clinics, they sign patients up and they get them on a whole whack of different, you got to take prescription this and DHA and thyroid and this and that and on and on. And they wind up with this grocery list of meds that they're going to be on, which I think is ridiculous. Okay. Now, but this for me is one of those ones I said, if you do need the two, by all means, DHA and pregnenolone, I find if you're deficient, like you're measurably deficient in your labs, yes, bring it up. I do not recommend everybody just jumping on DHA and pregnenolone, but you want to deal with someone who's actually going to listen to you, who isn't there to just gouge your wallet and just get you on a whole bunch of stuff. I like minimum effective dose. I like the least amount of supplements or the least amount of things possible to arrive at your optimal spot. And one thing I've always admired about Justin, and pretty much everybody I've sent that his way, have all told me the same thing. He really, really listens. They don't feel like they're just a number, just somebody that just make money off of. His prices are super reasonable. He does a fantastic job. His place is called The Restore Clinic. You can check it out at www.therestoreclinic.com. And Justin, there's only a number of states, I believe, in the U.S. that you cover, correct?
Correct. We are 8 states, and I will try to remember them. Tennessee, obviously, Arizona, New Hampshire, Washington, Colorado, Utah, Nevada, and Florida. We re-upped Florida as of 1 month ago. Yes.
Awesome.
Now, we're located in Murfreesboro, Tennessee, but we are planning on moving within the next few months, just because I've moved. Me and my lady moved more to the rural area, but we'll still only be 30-45 minutes down the road from where we are, so still within a stone's throw of Nashville.
Okay, cool. Awesome.
Yes, sir.
Very good. Thank you very much.